Now, Erie's premier podcast. News about music, health, and what's happening. It's Breakfast with Nat the Hat in the 814, sponsored by Erie Insurance.
Well, just doing some reflection on these blissful days of summer spent on the shores of Lake Erie. You know, I'm filled with nostalgia and deep sense of gratitude. From sunrise to sunset, its moods and colors paint the canvas of our existence, offering moments of tranquility, awe-inspiring vistas that never fail to amaze. Community in the 814 isn't just a concept. It's a living, breathing part of our summer existence. All the festivals, gatherings, bringing us together, celebrating everything from our rich maritime history, bountiful harvests in the fall, and it goes on and on and on. Podcast 38 is titled Gracefull Transitions and Health Programs in the 814. I welcome the Director of Operations for LECOM Visiting Nurses Association, Karen Dorman, and also Lauren Carson, the Epidemiology Research Associate. You know, that's hard for me to say. Epidemiology. Right. I'm going to ask all about that, too. From the Erie County Health Department, welcome you both to Breakfast with Nat the Hat in the 814. Karen, it's good to have you back.
Yes, thank you for having me.
And brand new to the show, Lauren Carson. Lauren, thank you for dropping by today. Lauren, Karen is no stranger to our podcast. We spent some time together during the Winter Wings of Hope for VNA last holiday season. And I don't know if you know much about it, but Karen, thank you for sharing all that last year. I cannot tell you how many people sent me texts, photos of my loved ones' names on the billboards. Like, people actually sat at the billboards and waited for the names to come around again so they could take pictures and send them to me. And that LECOM VNA had all those different billboards around town over the holiday season. I'm hoping we do that again.
Yes, we will be doing that again this year.
That's fabulous. So tell us about the LECOM Visiting Nurses Association of Erie County. Karen, let's give people a rundown.
Thank you.
Sure.
You. So the Visiting Nurse Association of Erie County is a home health and hospice agency. We are affiliated with LECOM and AHN. A lot of people don't know that we are a joint venture with St. Vincent here. And we do provide home health and hospice services. Home health meaning skilled nursing services, therapy, physical occupational speech therapy, and caregiver assistance as well.
There are so many programs. Yes. And all these services are available 24/7.
That is
correct? That's awesome. When did VNA start providing professional home health care and compassionate hospice and palliative care services to patients in their homes?
So it's a pretty interesting story, and we have a very thick, rich history in Erie here. Actually, 1906 is when the Visiting Nurse Association first pulled their board together.
1906. Mm-hmm.
Yes.
Wow.
Yes, and officially started providing services in 1916.
Do you have any photos? You have some rich history that...
We do.
Do you?
Yes. So interestingly enough, I believe it was last year around fall time, we were cleaning our office and we found the first board meeting minutes from 1916. The handwriting is beautiful.
I'm sure it is.
Handwritten. It's pretty interesting.
So you actually had a board. Mm-hmm. Did it say how many members were on the board at that time?
I can't remember off the top of my head, but very few. Very few. Yeah.
That's so interesting. And, it's that time of year again. And before we go into the whole butterfly release that's coming up for VNA, I've got to tell you that since last May, my mother has been part of the VNA hospice program. And just everything that your organization does is just a class act. We have our nurse once a week that comes in, takes all her vitals. It's Melissa. She's wonderful, and talking and making sure that all her meds are what they should be, and when she's running out and all that good stuff. And then every 3 months, the doctor comes in, who, by the way, is a nice young man.
He is.
What's his name?
Dr. Seth Carter.
Yes, Dr. Seth Carter. All of us girls we woo over Dr. Seth Carter.
I'm just not the only ones.
And just very kind. And then, tell us about some of the different things that you do. Like, I know that she's received flowers and There's so many little things and little touches that make your organization so great.
Yes, and that is all made possible through our Wings of Hope Fund that we'll get into in a little bit. But we send flowers to the patients on special holidays, Mother's Day, Christmas, whatever it should be. We try to remember special moments, birthdays, things of that nature. Mm-hmm.
It's like next thing you know, I come in the house and she's got these flowers. I'm like, do you have a boyfriend? She'll go, no, those are my friends over at VNA. So this is where all this money goes, the Wings of Hope, which do we have a date this year for that?
We do, yes.
Awesome.
It'll be August 3rd. This year we've added a band again. I believe we had the band last year, so that'll start at 12 noon with the program starting at 1 p.m.
Tell me about the band at noon. What do we got going on?
Mike and Marie, they're a local band. They're absolutely phenomenal.
I know exactly who you're talking about. That's great. Yeah. What's the day on that?
Saturday.
Saturday. Mm-hmm. So it starts Saturday at noon. Who do we have speaking during the program this year?
So during the program, we have Monsignor Rubino. He will be doing the invocation. We have a volunteer from Embracing Our Veterans.
Nice. Another organization that I love that has been on the show several times.
Yeah, they're big supporters of this event every year. And then we have Colleen Priddy from the Erie Playhouse. She will be singing during the event. And Alex Hedinga from the Erie Philharmonic has joined us.
We've got some heavy hitters this year. Mm-hmm. Well, I got to tell you, I've done the butterfly release, and it is just phenomenal. I love it. And then we all get to release our butterflies. It really is. It's a touching couple hours.
It is.
And then there goes the monarchs.
There they go.
There they go. Mm-hmm. And every time, and I lost my sister to cancer at 53. So I do the butterfly release for her. And every time I see a monarch butterfly now, I think of her. Or any butterfly that comes around me, I start talking to her like, she's my sister, because that's how I feel. She's that spirit. Mm-hmm. Well, that's really great. And how do patients and families typically respond to participating in this? I know what I felt.
Yeah, it's very amazing. It's very uplifting. We work to make this more of a celebration of life every year, because really we're there to celebrate our loved ones that passed rather than having the somber service. But you can see everybody in awe. Sometimes there's not a dry eye in the crowd as the butterflies are released. Some of the butterflies will stay with you for a while and crawl on your hand, and some just take off. And it seems like they almost take the personality of whoever you've purchased it for.
Right, and I videotaped one of my own with one of the butterflies, and it did happen. It just landed on her shoulder, and she was so excited. And how many butterflies do we normally release?
500.
500?
Mm-hmm. Yeah, it's pretty incredible.
That's great. We already know what's been planned this year. And I welcome the Director of Operations for LECOM Visiting Nurses Association, Karen Dorman. Karen, with my mother in the program, I can attest to this remarkable program in a world, that is often overshadowed by the hustle and bustle of everyday life. It's crucial to take a moment and acknowledge the profound impact that VNA has in regards to hospice care. It embodies compassion, dignity, unwavering support during the most challenging moments. And that's just not for the patient itself, but the entire family. And VNA recognized the importance of addressing not only the health of their patients, but addresses emotional, those social needs that we all need as a family, as a community. So I thank you. Last time you were on, I didn't know much about the organization. And then since my mother's been in the program, I'm thankful.
Well, it's certainly an honor to have her in our program.
Yes. Now, Karen, not only are you in charge of the hospice program, tell us, I believe you got some more things going on in your life these days.
Yes, some new added responsibilities.
Okay.
So again, my position is the Director of Operations for all of LECOM's Home and Community Services, and it's certainly an honor to be able to serve LECOM and our community. I work very closely with our personal care homes. We have 4 personal care homes in the area.
Where are those located?
So we have one in the Frontier area, that's on 322 Washington. We have one at Elmwood Gardens, so it's a skilled nursing facility and personal care home, which is really nice for patients that are looking to age in place. We have one in the Glenwood area, that is Parkside Glenwood, and one in Northeast, Parkside Northeast, right outside of the park.
So if there are any of our listeners out there that are considering getting involved with senior living, how do they go about doing that?
They could certainly reach out to us for the Wings of Hope. We do have a website. It is wingsofhopeerie.com. But then we also have just launched a new website, LECOM.com.
Nice. And for our seniors, like, it's just not finding a place for them to live, but it's all the other programs that they are involved in. Tell us more.
Right. To interconnect them. We have a wider range of services through LECOM. We really try to treat patients mind, body, and spirit. So there are many different resources for them, from skilled living services to rehab units, visiting nurse association, care in the home, assisted living, independent living as well.
I love that. Because sooner or later, I was telling Karen earlier that, I only have one son, so I know where I'm headed. When you have daughters love to take care of you, because all of us daughters are taking care of Mumsy right now. But I know there's just not going to be time enough for me, because a man leaves his mother and clings to his wife, which my son is doing this weekend, by the way. I am marrying my son, Dylan. So I'm very interested in knowing, is there a dementia unit too as well for those that are suffering from dementia?
So I'm glad that you asked, because we do have 2 secure dementia units in our personal care homes. Parkside Northeast and Parkside Glenwood both have a secure dementia unit specializing in dementia care. And we are currently working to expand our dementia unit because the services are so underserved in our area.
I was going to say, there are so many more people that I know that have family members suffering from that, or themselves for that matter. Do you see that increase as well?
I do. And just to share, I also am working with one of my loved ones that's suffering from dementia at this time, and it's been quite the journey, and LECOM has supported us every step of the way. But I've seen firsthand how important it is to have the secure unit and trained personnel to be able to handle someone with dementia-like behaviors.
That's a 24/7.
It is.
Just like when you talk about the services that are available 24/7, when you're dealing with that is definitely a 24/7 job. What would you say to somebody that is right now dealing with a family member with dementia?
I would say that they need to reach out for support. Sometimes it's an uncomfortable conversation to recognize that you need a little bit extra help, especially for elderly patients that have been together for 50, 60 years, and they've been making it through. But certainly reach out to LECOM, and we can help guide you through whatever services we have available. And if we don't have the service available, we'd be more than happy to connect you with another community resource.
When we're speaking about dementia, can you tell me, has there been any breakthroughs whatsoever in regards to slowing that process?
I have not heard of any breakthroughs, but what I can say is I know Dr. Lynn is currently working with Medicare to develop a dementia-related program for participants in the community, which should be coming out very soon. He'll have more information, but...
so that will gather research, and
yes,
Dr. Lynn is fabulous.
He is.
He's a fabulous man. And because... let's be honest. I know I'm a baby boomer. I don't think Lauren is. Karen, how about you? No. Are you a Generation X?
I'm Gen X.
X, yes. Z, or beyond Z?
No.
What are they called Z after Z?
I don't know.
Do we start out?
I don't know if
do we
ping on?
Yeah, I was going to say, do we start on the alphabet all over again?
Feels that way.
Oh, well, that's what I'm saying, though. But a majority of Erie County and the surrounding areas, we're the baby boomers, and this is where we're headed, and the health issues that are coming up, and parents who need our help. They take care of us all our lives until we go off under our own, and then we turn around and we come back and we take care of them. So it's really, really important that they know that these services are available. I mean, I know I'm taking Prevagen right now, but I don't know. I'm sure Dr. Lynn would probably kind of get a chuckle. But anything that sounds good that you can, because I know as the older we get, I mean, I'll walk out of a room but I got this good deal going now. I go back into that same room and then I remember what I needed. So I notice that happens more often. So there's a lot of factors in that. I think LECOM has really come a long way. I mean, and has done a lot for our seniors in the community.
Yes, I agree.
So we got the butterfly release Saturday, August 3rd. Okay. Starting at 12 noon. Can somebody come right there and get their butterfly, Karen?
Yes, you can register at the door. But if you're interested in pre-registering, we do have our website up, wingsofhopeerie.com.
And it's at the campus.
It is at the campus.
Right behind.
Yes, 2000 West Grandview Boulevard.
That's a beautiful campus, by the way.
It is.
I love it there. So it's Director of Operations for LECOM Visiting Nurses Association, Karen Dorman, and also Lauren Carson, the Epidemiology Research Associate at Erie County Health Department. Welcome to Breakfast with Nat the Hat. Now, I need to know more about Lauren. I don't know. Lauren, you're new. You're new on my microphone, so I got to ask you some questions. Did you grow up in Erie?
I did. I've been born and raised in Erie.
Tell me where you went to school.
I am from Mill Creek. I went to school in Mill Creek schools my whole life. I then continued my education at Gannon University, where I've got a bachelor's.
She's an alumni. What year did that happen for you?
I started my college trek, I'll call it.
Oh, there's a trek.
Oh, yeah, there's a trek.
There's nothing wrong with a trek. Sometimes it takes a little longer than usual.
Yeah. So I started in 2014. I'm now working on my PhD from Gannon. So I've going on 3 degrees from Gannon. So.
3 degrees. I got out in 1. I just want to let you know. I did start up on my master's program, but never finished up. I ended up in radio, and then, just years and years and years got away from me. Well, welcome to the show. Wow. Now, you can come back on my show again, and we'll call you Dr. Lauren.
Hopefully.
That's
working on it.
You're working on it. Great. So, we need to talk about this assessment. Not too long ago, my friend Amy Chevalier ended up, contacting me, and she goes, Natalie, we have this really cool assessment going on, and we would really like everybody to take this assessment. Tell us about this assessment and what it's all about.
Yeah, absolutely. So the Community Health Needs Assessment is conducted by the health department every couple of years. And it's an assessment that is used to allow our people living in Erie to share their experiences, share their needs, to have a voice in kind of what they experience socially, mentally, with their health, with their environment, and really give us a chance anonymously to tell us what they really need.
Do you do this every year?
We do not.
Okay. So you only assess on occasion?
Yes.
Okay.
So we say every few years. It's supposed to be every 4. We were hit with the pandemic. The last one was conducted in 2018. And I think we all realize our needs have changed
Dramatically.
So this will be our first one since 2018. So it's a little delayed, but we're glad it's happening now because after overcoming a pandemic, the need, like as we said, the needs have really changed.
Especially the mental needs.
Absolutely.
For so many people. Tell me about epidemiology. Is that what your, career's in? Are you going to be a doctor in epidemiology?
I'm not.
Okay.
But I'm pursuing my PhD in organizational learning and leadership. Being in public service, I think it's important to understand how we can better lead our community and educate our community. So that's the route I went when furthering my education. But my experience in public health and epidemiology is really my passion. So epidemiology is really tracking those trends and statistics of our health and our populations.
Do you like the numbers? Are you a numbers girl?
I love the numbers.
Good, somebody does.
I always say, like, I hate words, but I love numbers. I could do numbers all day.
Sure. So where did you start working after you got out of school? I mean, to where you are at right now at the health department.
Yeah, I originally started doing research with UPMC. I was doing actually cardiac research on atrial fibrillation. So meeting with patients, enrolling them in a study. The study was utilizing an application, a mobile app, to help them monitor their condition.
Okay.
So I started doing research, and then I really did want to be in public health ultimately, though. So once a position opened up, I was really excited to apply, and here I am almost 5 years later.
I was going to say, it's been 5 years with the health department.
Yeah.
A lot of changes in the health department, I've noticed. I do believe like the smoking cessation that I had the opportunity to talk to Amy about, that has been given to somebody else. What are the changes that have been going on at the health department as we speak?
Yeah. So, I mean, with the pandemic comes many changes, especially to public health. So after that, obviously, our focus has shifted. Different things have came to be, and with those shifts come funding shifting. So some of our funds have shifted. We no longer have the funding for the tobacco cessation program. Another entity in Erie has taken that over, and we feel good about that. So we are trying now to focus on the after pandemic things that need to be addressed.
You know, I know that there was a huge lean during the pandemic on the health department because everybody wanted questions answered. Tell me what it was like to work through the pandemic at the health department.
So my first day at the health department was 3 days prior to our first case of COVID in Erie County.
Oh. Wow. So you were just tossed right in the mix.
Yes. And I will say there's no better way to learn than just to do.
Sure.
Yeah.
Was everybody still coming into the health department, or were you all working remotely at the time?
We did work on site because of the nature of our work. It was really important to us that we had to be there. We had to be collaborating. We had to be talking. We had to be there for the county and the public. Eventually, at the cost of everyone's health, we did transition into a model where we could work from home and in the office as needed. But we were.
I am sure, and you know, as I could tell during the pandemic, the heavy lean on media, on what was going on, and everybody kept, you know, wanting to the health department to, and so many times things changed, and does that come down from the state? All the different things that went on during that, like the state would tell you, or how did that work?
There were times where it was the state, and there was times that the state said it was on the county. So there were different situations where it would be the state or it would be the county, but we did heavily depend on media at that time. It was really the way to reach people. So I like to think that during that time we really trusted in being transparent with the community.
I totally agree. You were wonderful during the pandemic. Your entire organization did great work because there were just so many people saying so many things. So it was nice to have the health department break it all down and tell you what you needed to do. And everybody leaned on the department a bunch. And I know because where I was working too, we had to go into the office because we were necessary workers. So then I know what it felt like for you. So you just got there and boom, Here we go. But I do think that we all learned a valuable lesson from the pandemic. I'm sure the health department has all kinds of things in place now that we never thought that we'd see in the past, right? How about hospice? What happened with all that, Karen?
It was an adjustment for sure. You know, the first month was a big learning curve for our team. But as she stated, we were necessary workers, so we were in the office. Our nurses were visiting patients in the home. A lot of our patients that were unfortunately succumbing to COVID still needed to have that hospice care. So we had to regroup and learn how to manage the symptoms from COVID-19, and we preserved.
There was a lot going on with you,
There's
too.
a lot going on.
Phew, I'm glad that's behind us. It definitely was a lot. So let's go back to the survey. Can anyone take the health assessment survey? Do you have to be a certain age?
Yes. You have to be 18 years
Oh,
old.
good. Just past that.
So, yeah, we're looking for 18 years or older and that you live in Erie County. We realize that we have a college population, people who may not actually live here. So we really want to hear from the people who live here and can really share their experiences so we can figure out what the needs here in Erie County are.
Well, you just handed me the survey before we got on here, and it's voluntary.
It is.
It is, and the information will be kept confidential. That's very good.
Yep.
Not asking for names or any personal information to identify you. So people can be quite honest.
And that's what we want. That's the plan.
Exactly. And it says the survey could take up to 20 minutes. And from what I can tell, it is about 20 minutes. When you hand it to me, I'm like, oh, this is page 1 of 17. The one is just, oh, no, it's on the back. I see. But this is, how about your health? And then what do we do with all this data? Miss Numbers.
Yeah. So it's actually the copy I handed you is a paper copy. The survey actually this year is designed to be a virtual survey, so it is available on any mobile device, iPad, online, and but we do have paper copies available.
Okay.
So paper copies at request can be sent out with a stamped envelope so that you can fill it out for no cost and send it right back to us. And with no information, we can enter that, and we will not include any of your personal information. So there are those options for filling out the survey. With the data from the survey, we are hoping that will feed into our community health needs assessment, which will then steer our community health improvement plan, also called the CHIP.
Let's talk about, when I think about CHIPs, I think about, I think about the insurance for children.
Yeah, no.
This is totally different from the CHIPs that I've been aware of.
Yes.
Okay, so what does CHIP stand for?
CHIP is the Community Health Improvement Plan.
So how many years is this plan in play?
Until the next assessment is conducted.
So that'd be like 4 or 5 years from now.
Yes.
So this assessment is really important for our community.
Yeah.
And it brings up, what care have you been, needing, dermatology, just all aspects of health.
I'm glad you brought up dermatology because that was actually one we went back and forth with. So when designing the survey, we discussed different options for what to include. We didn't want to go with the standard surveys that everyone used because living in Erie County, we know we have unique things here that may not be elsewhere. And we realize there's this shortage in dermatology services in Erie. So that was something we decided to include to see if there is a need here in Erie.
Right. I see that, so when you put this all, tell me how you put something of this caliber together. How does that work?
There's guidelines for conducting a community health needs assessment from NACCHO and other organizations. Typically, the surveys of this capacity are designed from the BRFSS survey, which is the Behavioral Risk Health Surveillance Survey.
Okay.
I may have butchered that, but
that's okay.
Typically, they're designed off of that, but those are very standard across the nation. We realized that Erie had some specific areas that we wanted to include. So other areas were things about gun violence, dermatology, as you said, a big, huge focus on mental health, drug use and abuse, other things that we knew really needed to be addressed that aren't typically included in a standard across the board survey.
How about our seniors?
There is
Okay.
definitely information about seniors, and we also included sections about intellectual and physical disabilities because we thought that was really important as well.
Sure. So when this assessment is done, then Karen could take a look at some of this research that you've done to see how LECOM is helping
Absolutely.
the seniors in the community, right?
Yes.
So this handles everything, is what you're saying. Pretty
Hopefully.
much. Yeah.
Hopefully it identifies the big trends in our community. And on that note, we have representatives on our steering committee who helped us to design the survey to incorporate their needs as well. So there are representatives from LECOM, all the major hospitals surrounding us, from MEDS, which is our multicultural medical service entity in the county. We have Community Health Net. We've tried to get a very broad steering committee to incorporate.
Well, I've been involved with FPAC before. So FPAC is the one that sent down the assessment, and then we pushed it out at my nonprofit organization to make sure that, because you want to be a part of this. This is important for Erie and Erie County. Our health is important.
It is.
Right? So when all the data is gathered, what happens next? You just don't put a machine and everything just comes out, or you're that numbers girl. So
I'm the machine.
you're
No, we after the assessment is complete, as I said, it drives our community health improvement plan, which then drives a lot of our strategic plan and our programming and the programs that come out of the health department.
Well, let's talk about advocacy with this then. Then if this is done, does this go to our legislators to say, these are our needs? No? Yes? No? Maybe? I was
I
just
don't
thinking.
know the actual process
Okay.
for that. Ideally, yes, but
But I'm thinking, because when I think of Governor Shapiro, he's now, putting more funds into mental health, our senior programs, things of that nature. So this would be a great survey to have to take up on the Hill when in due time.
absolutely.
Right?
The big focus for us in the survey was collecting data that we don't have access to. We need the data to be able to gain the funding to provide the services to our community. So when we looked at what questions were we going to ask, we wanted to ask things that we didn't already know. We know we have a lot of data. There's a lot of things that must be reported to us, but there was a lot of things that we didn't know. So this will hopefully fill those gaps for us so we can get the data to then get the funding so then we can provide the programs needed.
So you're saying that if listeners don't have a computer, they can have this mailed to them. Do they
Yes.
just have to call the health department to do that?
Yep, you can call the health department. The number is 814-451-6700.
See, my LECOM listeners need to know this because I know a lot of them. And sometimes I would prefer not to have a computer myself. You know what I mean? And I'm a paper girl.
Yeah.
I am such a paper girl. So they can get this sent to their house. They can fill everything out and send it in because we do need a lot of representation. Is there a deadline for this?
There is not a deadline at this time. We want to hear from everybody. So we are going to be accepting surveys for as long as we possibly can and
Go from there.
go from there.
So now that I'm talking about the health department, I know that there's a lot of drug abuse and misuse in our community, and I've spent a lot of time talking to those in recovery and the organizations that help them. Can you go to the health department and get Narcan for yourself?
At this,
Or, to make sure that you have it on you in case you...
I don't know that we are giving it away at the health department
Okay.
at this time.
Okay. I just know that there are some things you can come to the health department to get. And
Yes.
what would be that?
At this time, I know for sure we are distributing at-home COVID test kits. So if you need those, we also still provide services. We have immunizations for people who are uninsured or underinsured. We also have testing for TB, sexually transmitted diseases. We are still offering those clinics as well.
Thanks for updating me, because I think of the health department as this big entity. They do a lot of things for a lot of people. But it would be great if people got together and got this assessment so they can do it online. Do they just go to the health department website?
You could Google any of our social media, so Health Department Facebook, Instagram, Twitter, and there are QR codes that you could actually scan on a mobile device. Really easy. We'll bring you right to the survey. We also have our website. There's a direct link. It is eriecountypa.gov/health survey.
Oh, there's the slash,
Yes.
the health survey slash.
Yes.
Perfect. I have Director of Operations for LECOM Visiting Nurses Association, Karen Dorman, and Lauren Carson, the Epidemiology Research Associate at the Erie County Health Department. Two things we need to walk away from today, and our listeners need to know, is the butterfly release is coming up on August 3rd, and all monies raised go to the VNA Hospice Program. And it starts at 12 noon, right? And the release is after the program.
After the program.
So you're looking at about 2 hours.
Yeah, about 2 hours. I would say probably about 1:30, 1:45 is when we'll be releasing the butterflies.
Got it, Karen. I'm so glad to see you again. It's always a pleasure to talk to you, especially, and then we'll have to get back into the Wings of Hope and the billboards, and just you did great work.
Thank you.
And I'm personally can attest to the fact that the VNA Hospice Program is the best. Just the absolute best. Thanks for coming on again. And then, Lauren, we got your assessment that we want everybody to take.
Yes.
And so we can find out what's going on in our community in Erie County and be able to put all that research together. And then once the research is done, can people retrieve that data wherever?
Yeah, so that's another exciting thing is this time around, we wanted to make this as accessible to people as possible. Previously, this was conducted through phone interviews. So actually randomly selecting and calling 1,200 people over the phone.
I can remember volunteering.
So that we really wanted this to be more accessible. So going a different route, making it mobile, making it a paper copy or on the web. And then also all of the results will be published online in a very visually pleasing way, using a dashboard, lots of visualization, easy to read. The last one is a 100-page PDF or so.
I'm sure.
Online.
Sounds like part of your PhD program.
Yeah. So we knew we didn't want to go that route again. We wanted this to actually be accessible and used, and we wanted people to see the results and understand the results.
Right. Well, there's a lot that can be done health-wise in our community.
We have a lot of work to do.
We have a lot of work to do. Yes, we do. Then we have the wonderful work of LECOM and all the different programs that they provide. So a reminder to our seniors that if they need any help, Karen, they can get right on the web. If they don't have the web, they can call.
Yes.
They can call any of your facilities. Can you name those off again for me so we can?
Oh, sure. There's a lot of them. I know.
I know.
We have the Parkside at Northeast, Parkside at Glenwood, Parkside at Regency South Shore, Parkside Westminster, Parkside Corey, and Parkside Elmwood.
Whew. And then, of course, the hospice program.
Yes,
for
the Visiting
VNA.
Nurse Association as well.
There's a lot going on.
I can tell you if you reach any of our buildings, they will assist you in retrieving contact information for the other buildings as well.
Perfect. Well, I thank you both for being on the show today. And I'd like to end the show with a quote from Cicely Saunders, who founded the very first hospice and also developed the holistic approach to palliative care. And Cicely said, back in the speaking of 1906 at the beginning of VNA, you matter because you are you, and you matter to the end of your life. She said, we will do all we can, not only to help you die peacefully, but also to live until you die. So everybody, make it a great week in the 814. Thanks for coming on today.
You've been tuned in to Breakfast with Nat the Hat in the 814, sponsored by Erie Insurance on 88.5 and 102.7 LECOM Radio.